Hey guys, today's topic is microneedling. This is a really popular treatment that's been done for the last couple years, and we have used so many different types of pens, and I want to share with you the one we use. I want to also fill you in on what you can expect from a treatment. So the reason you would even do this treatment or consider it is for lax skin, fine lines and wrinkles, hyperpigmentation, and acne scarring. You don't want to do this if you have active acne because you can actually move the bacteria and possibly cause more irritation and more acne. You don't want to do this when you're going to be out in the sun. So this is a great treatment to do when you can kind of hide away for a few days. Do it on a Friday, go back to work Monday, nobody will know you had a thing done. Things to know before treatment: come off all your blood thinners. The pen can go pretty deep in promoting collagen production, and if you take anything like fish oil, turmeric, if you're using ibuprofen or just any other blood thinners, if they're prescription, talk to your doctor. Of course, talk to your doctor always first. But lastly, if you keloid, this is not your best treatment. Okay, outside of that, any skin type can do this. That's amazing, because heat's not involved. And we can get really close to the eye for that same reason, because heat's not involved. And what microneedling is used for is to promote collagen production. It's gonna totally rejuvenate your skin, and at 90 days, you actually peak. So that's when collagen from day 1 all the way to day 90. At day 90 is when everything starts looking glowy and dewy. Although I think that most clients notice a week later, 2 weeks later, their skin looks beautiful. So it's like a double whammy. You get it after about a week and a half to 2 weeks, and then again at 90 days, you're like, why is my skin looking amazing? Oh yeah, you microneedled. So when you go into the office, we numb you. We use this cream right here. It's called a BLT. It's 20% benzocaine, it is 4% lidocaine, and 2% tetracaine. We use the numbing so that you don't feel the needles. The needles essentially aerate your skin, allowing for certain products to penetrate better. And then also, just by that penetration, like aerating your skin, it releases cytokines. What cytokines do is they go down and they build collagen. So you age more gracefully. You're also able to correct hyperpigmentation because you're getting a little exfoliation on the surface of the skin, and acne scarring. It's really great for both of those. This type of treatment is done in a series of 3 to 5 treatments. You want to do it when you're not going to be in the sun, so that's really important. Stay out of the sun pre and post treatment. Now, let's get down to it. What does it look like? This is what the handpiece looks like, and we are currently using the brand Skin Pen, and the reason for that is they have created this pen with needles, which once the needle is attached to the pen, and then after a treatment you pull it off, you cannot reattach it. Now, I didn't know that would ever be a problem, but contrary to what I knew, they're actually it's kind of horrifying, but there are places that sometimes will sanitize it and reuse it. So look out for this type of pin because you can't reattach the tip. So that's really important information for you to have. Also, in your little packet comes a sleeve. We put the sleeve over your handpiece. So everything is protected, covered, really sanitized. And lastly, we use hydrogel. So this hydrogel helps the pen to glide on your skin, and then you also take it home so that if you feel extra dry or your skin's just a little uncomfortable, you can apply this for the first 12 hours. For 12 hours, you cannot apply anything else. In fact, after a treatment, you're red. I tell people do this at the end of your day. Go home, relax, watch a good movie, and by the next day you can apply makeup. It is about 3 days of redness and maybe some irritation. It can be longer if you experience a little bit of flaking, but really by day 4 or 5, nobody would know you had a skin pen done. Or microneedling, Rejuvapen. These are Skin Pen and Rejuvapen are name brands. Microneedling is the procedure, just for your info. So anyway, lastly, the reason we don't use this bad boy in our treatment, which some places do, is because TNS Recovery Complex, although this is an amazing product, it uses it's a human growth factor. So human growth factors build your collagen, and they're incredible for your skin if you have healthy skin. But I work in a dermatology and skin cancer office, so a lot of patients that come through here have had previous skin cancers on their skin. And anytime you have dealt with that, it's really important to use plant-based growth factors, which we have, rather than a human growth factor, because human growth factors can overstimulate cells. And so if your cells aren't healthy, you might get the downside of that cell stimulation. If your cells are healthy, then I mean truly TNS Essential Serum and then Recovery Complex, I mean these are gold standards, but you just need to know if it is right for you. If this information is helpful, click like, share this with somebody you love, and have a kick-ass Wednesday.